People who are recovering from COVID is getting a new disease, a deadly rare disease, the black fungus.
Ethnic Health Code, Forward to Good Health.
Hello, I'm Sunil Prabhakaran and welcome to another episode of Ethnic Health Code. In today's episode, we are going to discuss about the black fungus, which you might have already heard about in the news, that the COVID patients who are recovering is getting this infection or this new disease. It's a deadly disease which is called the black fungus. Let's understand about what exactly this black fungus is all about and how it get affected and what are the symptoms and what's the treatment method. So the black fungus is a very serious rare disease. So according to the CDC, black fungus is a fungal infection. It's a group of fungus molds which is called the mucormycosis. So black fungus is also known as the mucormycosis, and it's available and it's living throughout the environment, and it affects the people who have the low immunity. I mean, people like who are taking medicines for a long period and their body is weak and they have a low immunity. These are the kind of people who have the chances of getting this black fungus or the mucormycosis. And the doctor says it's not that threatening here, the situation is, but still the cases are going high and its report says that this disease is reported in many parts of the country. So let's look into what kind of people or who are the people who can get infected. As per the ICMR studies says, Indian Council of Medical Research says, there are 4 kind of people who can get this disease. The number 1 is the people who had taken long-term steroid use when they are in the COVID medications, when they are in the hospital for the treatment of the COVID, the people who had taken the steroids for a long term. These are the number 1 category of the people who can get infected about this disease. And number 2 is the people who are staying in the ICU for a long time. I mean the COVID patients who are in the ICU for a long time. And the third is the people who have the diabetes or people have the history of the heart disease or the kidney failure. These are the third category. People who have the diabetes, heart failure and kidney failure history. These are the people. And the fourth one is on the medication for a long time, people who are having certain kind of diseases and they are on the medication for a long time. So basically their immunity will be low, and these are the kind of people, these people also will get infected. So basically these are the 4 categories. And how the infection starts? The infection starts from a normal irritations in the nose, and it can even reach into the brain. And what are the symptoms? Let's understand the symptoms. There are 7 symptoms which associated with this black fungus. The number 1 symptom is the pain under the eyes. You will get severe pain under the eyes, and then the one side facial swelling. You will get a facial swelling in the one side of your face. And third one is the nasal or sinus congestion. You will feel a kind of a congestion in your nasal or in a sinus parts. And fourth one is the black lesions which appears on the nasals, on the bridge of your nose. So you can find out this small black lesions which can appear on your nose. 5 is a stuffy or bleeding nose. Bleeding nose is the other symptom. And the 6th one is you will get severe toothache and maybe loosening your teeth. This is also a symptom. And the 7th point is partially losing your vision. You will lose your vision partially. So these are the 7 symptoms which has to be taken very seriously, which has to be taken very care. And how can we protect it? Again, it comes to the basic protection method: wear a mask, because these fungal infection basically enters our body through the nose or through our mouth. So wear a very good mask, which can have tight mask which can protect this. And other thing is that cover your body completely. When you are going out, basically they are saying when you go out to the park or any vegetable places or any kind of vegetations where you go, have a complete cover. You cover your body completely. You wear the proper shoes, your pants, and all those things. So wear a complete covered. You cover your body completely and take care of your personal hygiene when right from you washing your hands to taking your bath. And the treatment part. So the treatment part is of a bit of a challenge because as you know, this is a deadly virus, and what it does is it affects the certain tissues of the body. So when this affects, you have to surgically remove the tissues from the body. So that's the treatment plan, and it's pretty dangerous because if whichever part it's getting affected, it has to be removed. If it's a nose or it's the parts of eyes or even your brain. So that's the most threatening and the challenge part. And the other treatment is give an antifungal therapy, which is an expensive, which says like you need around 9,000 rupees for a 1-day antifungal injection itself. So it's an expensive treatment too. So these are the informations which is available about the black fungus. So take care very much. Hope you got the picture about the black fungus and how deadly it is. Look into the symptoms, understand it, and take care of yourself. Thank you very much.
Ethnic Health Code. Forward to good health.